Good morning, everyone. First of all, I'd like to say thank you for choosing Lillian Feinstein at Sackett for the very special event that will occur on Sunday. I'd like to welcome Governor McKee, Lieutenant Governor Sabina Matos, Rhode Island Department of Health Director Dr. James McDonald, Commissioner Infante Green, Superintendent Dr. Montanez, Pastor Abuli, and Director Mark Pappas. So, welcome. It's a pleasure having you here. Governor.
Thank you so much. It's great to be here and joined by all my colleagues that are working hard on issues relative to our schools and also the COVID and vaccinations and booster shots. So it's great to be here in a gym where I feel very comfortable in a gym. I'll begin with an update on Rhode Island's current COVID data. We're continuing to see a great deal of encouraging movement in our numbers since Rhode Island experienced its high cases in early January. Cases are down nearly over 95%. New cases over the last 7 days are declining as well, down about 67% from 2 weeks ago. Our 7-day average for percent positivity is down 47% from 2 weeks ago, and our hospitalizations have dropped 62% since mid-January. Especially encouraging news, considering it has almost 2 weeks since we lifted the statewide mask and vax protocol, and we have people in the state of Rhode Island to thank for this progress. We're in a much better place than we were last month, a lot better place than we were in last year, because Rhode Islanders are stepping up, doing the right thing, getting vaccinated and getting boosted. And we encourage everybody to keep the pace. Let's keep us nationally in the lead in terms of vaccinations, and shortly I would say that we'll be leading the country in booster shots based on the work that's being done right now to make sure that we're making it very, very important piece of our work as we go forward. As Dr. McDonald has said, over the last several weeks, COVID-19 has transitioned to a preventable, treatable disease. And that is good news for us. And we need to be prepared to manage it that way. So prevention becomes the word of the day. Preventable, treatable disease. While we're not fully out of the crisis yet, our team is putting the building blocks in place to safely move a stabilized state that can manage this virus as an endemic. Over the last several weeks, Dr. McDonald and I will be talking, over the next several weeks, we'll be talking about a strategy for Rhode Island to manage this virus as we move from a pandemic to an endemic stage. And as we implement this endemic management strategy, every decision will be deliberate, based on science, based on the data, and based on current conditions. Strong scenario planning for policy, operation, and resources will ensure that Rhode Islanders will have the confidence to take the next step in this process. A crucial piece of the endemic management strategy is ensuring that Rhode Islanders stay up to date on their vaccinations. This is a key component of managing our way through the next stages of this health crisis. That means getting your primary series and getting your booster. We're doubling down on our efforts and messaging to reach into communities to remind Rhode Islanders what it means to be up to date with their vaccinations. We're running ads on local radio stations in both English and Spanish, and advertising in local newspapers and on social media. We'll have canvases out in communities, the communities who have the lowest vaccination rates. We'll have people in those communities and information on vaccination, both comparing myths and facts. And again, I'll repeat, Dr. McDonald is giving us the best direction that we could have at this point in time. This is a preventable, treatable disease. Today, we're in the Lillian Feinstein Elementary during February vacation to emphasize the importance of vaccinations for our children. Right now, it is important that we get our children vaccinated as we go down the home stretch, Commissioner, in our schools and what we want to accomplish over the next several weeks in finishing our school year strong with our students in the classrooms, safely in the classrooms. That's why we're announcing our administration's latest push to hold a vaccination clinic in Central Falls, Pawtucket, Providence, and Woonsocket, in their schools that have vaccination rates less than 20%. We're starting with these communities because we know that since the start of the pandemic, they've had lower vaccination rates. We want to boost those numbers significantly. In fact, Lillian Feinstein Elementary is one of those schools. That's why we're here today. They will be hosting a vaccination clinic at the Sackett Recreation Center for the community on Sunday, just before students head back to school from February vacation. And yesterday, the Lieutenant Governor, the Superintendent, thank you for your leadership, Superintendent, yesterday visited student and family vaccination clinic at Nathaniel Green Middle School in Providence. In just a few short hours, over 150 people got vaccinated across two sites. This is fantastic news. These are good numbers. If we continue to repeat that over and over again, we're going to make significant progress relative to vaccination of students and the booster shots for in our school community and all the communities that in the state of Rhode Island, all 39 cities and towns. While almost all Rhode Island adults have received at least one dose of vaccine, 46% of adults have got the booster shot, and 38% of all Rhode Islanders have got their booster shot. And we have work to do here, and we encourage and we ask people to help us get that work done. So I will repeat the message. We need to boost our boosters. Please go out and get that booster shot. As Dr. McDonald said, this is a preventable, treatable disease. We know a lot more today than we did a year ago. We know how safe it is, and we know how to keep people safe. And that's why we're here today. We're doubling down on the boosters to make sure that all eligible Rhode Islanders are fully protected. We're engaging community partners in the effort. As part of that strategy, my administration is reaching out to faith-based leaders and communities with low booster rates, like Providence, Pawtucket, Central Falls, and Woonsocket, to ask them to invite a trusted doctor to speak during their service and host a booster clinic at their location right after the service. Yesterday, when we did visit yesterday's school, we met with some parents, we met with some students, we met with people who were at the school, and they really encouraged us to make sure that we were speaking directly to the communities in all 39 cities and towns in a way that we can communicate with them, right? So we're going to need to get into Spanish-speaking families with people who speak Spanish. And we're going to need to get into other communities who have good people that are respected, that can deliver this message that Dr. McDonald is strongly providing to us. The goal is to encourage leaders to promote vaccination and booster doses to members in their community and all our communities. The clinic itself will be open to the public. We are confident these strategies will have a positive outcome in reaching Rhode Islanders who have not yet received their vaccination or boosters, and we're very happy to report that the first clinic did take place last week at a mosque in Providence. And I know that it's the first of many because we are really organizing, and as we have throughout the 2 years, people have responded very positively, especially when we're asking and not telling them what to do. This is a team effort. I want to thank all of our community partners who have been crucial in boosting our vaccination rates. We have made really good progress, but we need to continue the momentum. We do want to make sure that Rhode Island is the #1 boosted state in the country. then we know that we're looking forward to a good balance to our school year and a strong summer for the people to enjoy in our state, and also it impacts our economy, and we need to keep people working, keep people earning money, because we know that is crucial to the viability of the state of Rhode Island. If you're hearing this message today and want to have a clinic in your congregation, reach out to Pastor Chris. Reach out to our office. Reach out to the network of our clergy and our leadership in all our churches throughout the state of Rhode Island. We'd be very happy to respond and make that happen. And we appreciate the help that is being provided in the faith base, along with other communities in the state. And this work is going to continue, as Dr. McDonald has said.